I have patients often 4 or 5 months into working with me saying, and I expect the email of like, why aren't I pregnant yet? And instead I get the email of, even if I don't get pregnant, I feel so much better.
Welcome to Heal, a podcast about the real stories of what it takes to heal. I'm your host, Dr. Sarah Marshall, naturopathic physician, published author, and psychedelic integration guide. What does it really take to heal? We sit down for raw, authentic conversations from science to spirit, trauma to transformation. If you want to learn more, go to my website, sarahmarshallnd.com, and sign up for my newsletter, where I share my most cutting-edge new thinking, what I'm seeing right now in the research and in my clinical practice. So you're getting the most up-to-date information, practical tools in your inbox. Check us out, join us, and enjoy the show. Fan-freaking-tastic. I have Dr. Grace Charles here. Thank you so much for being here with us on Heal.
It's so fun to be here.
I'm really pumped about this conversation. And I love the way that we met. It was like this serendipitous, you were networking for some Utah naturopathic connections. And after we got done just talking about that, I was like, oh my gosh, we need to hang out more. And I would love to share your expertise on Heal. So you are a naturopathic physician, as I am, licensed in Colorado and Utah, and specializing in holistic fertility care, which I think is massively important to bring literally the microphone to this conversation. That, IVF and all of the different interventions that we have is really important. And I'm grateful that we have all these ways of supporting people in family planning and creating families. But that is not the only option when you're struggling with fertility. And what else to be looking for and how else to think about it and what the options are on the table is just to give people choice, consensual choice.
Well, thank you for having me. Yeah, this is fun. It'll be a fun conversation.
Good. So I want to just kind of start there for you, which is, what brought you into that specifically? How did it come about for you that you wanted to choose working with families and helping support with fertility?
I chose fertility because it took me a little while to get to the fertility space. When I first graduated from naturopathic medical school, everyone was talking about epigenetics, and that was an exciting concept for me, though it did kind of lead patients. I was in women's health, and it left us at this a lot of this was predetermined by what you were exposed to when you were in utero or when you were a young child. And it left us thinking well, gosh, wouldn't it be great if we could intervene earlier? I worked with a lot of women with PCOS at the time, and the company line on PCOS, the researchers agree mostly that PCOS is a result of environmental exposures in utero. So what your mom was exposed to when you were in her belly. And that made me really want to shift to, can I affect the next generation health? Can I affect women's health down the road if we could get started a little sooner in that perinatal space and prenatal space? And the women who want to talk to you about healthy pregnancies are the ones that are having trouble getting pregnant. So I think that's what put me in the fertility space to begin with. And then once I was there, I don't know, there's no better expression of naturopathic medicine, right? We have to use it all. There's no workarounds, there's no cheats. And it's been a fun way to learn. I only work on fertility, but I have to learn about everything to do that.
Right. Yeah. I mean, that's the kind of irony, is there's not really such thing as a specialty in naturopathic medicine in the way that conventional medicine would look at it, because, well, my specialty may be that this is the target group of people that I'm assisting, but we're still got to deal with your gut. We still have to deal with your thyroid. We still have to deal with your toxicity and your liver and your kidneys and, all of it, right? Because that's actually healing.
If we are zoomed in on reproductive organs, we're doing it wrong.
Yeah. And so often that's where a lot of the frustration and pain and suffering happens. I mean, as we started this conversation, part of it is giving people full choice. And I'm a big fan of actually being at full choice. This is sort of a weird bridge, but I've been thinking a lot about consent, right? We talk about that from a sexual standpoint, being in full communication and having full consent, and taking it all the way into our consent over our bodies, what we put into them. That means informed choice. That means proper labeling on our food, right? I mean, if you get way deep into the weeds of what the EPA and the FDA do and don't have to tell us about farming practices and what's considered a food additive, and if it's put on post production, but before the food is actually turned into something, then it doesn't actually count as a food additive. Like
Yikes.
it's tricky, right? There's some weird loopholes, and that just drives me nuts that we at least aren't given all the information. So from there, to be able to say you have a lot of options to accentuate your fertility at the same time as not having to go straight to something as potentially intense on your body as in vitro fertilization, which can be a good option for people. But again, but then there's this other component, which is how often we just don't actually know. Like, I had a woman that I wasn't directly working with fertility, but a lot of what it revolved around was getting her protein status improved and her thyroid improved. And she got naturally pregnant on her own within 4 months. And they'd been struggling for 2 years.
Right.
And this was
Sometimes
not
it
a
really does
complicated
involve
thing.
a zoom out look.
Yeah.
But when we're speaking about intent, consent and IVF, I think that I think the consent is taken away when we're not given a diagnosis. We're given, this is what you can do. And patients that I work with feel uncomfortable making that choice when they still don't know why they haven't been able to get pregnant. And I think that's, for me, that is the connection with consent there. Because it's like, well, I'll do it, but I'll only do it if I have the information. And that information that's missing is the diagnosis. It's
That's an
unexplained
interesting
infertility.
gap, right? Because they're not really exploring what the reasoning is. So many people are left in a bit of like a helpless mystery of like, why, I just don't know. And I know both men and women can be left very much with a lot of blame and shame in that conversation. Like, there's just something wrong with me.
Absolutely. And there's a gap in the medicine. You go to your gynecologist, you say, gosh, we've been trying for almost a year. The gynecologist says, okay, well, we'll run the tests. And gynecologists are amazing. They treat everything from age, 12 to 80, and they're surgeons, and they're doing a lot. And the fertility tools they have are what's standard. Maybe they run the HSG, they run some blood tests on cycle day 2, 3, 4. And if all those come back normal, then they say, well, go to the next reasonable specialist, which is a reproductive endocrinologist. Reproductive endocrinologists all work in IVF clinics. So there's not much, there's a lot of gray space. There's a lot of space. And that's the space that functional medical, fertility providers like me work in.
Yeah. Okay, good. So let's walk through a bit of what those options are. And I like where you were headed of sort of this is the normal way that women will end up, and men, like couples will move through. We're, here we are. We've been trying for a year and it's not going the way we expected it to. We're still not pregnant. We're not sure what's going on. So kind of walk us through what the standard process is, and then where you and natural fertility options and naturopathic fertility options can come help fill in those gaps.
It really depends on how comfortable your gynecologist is with fertility diagnosing. Some are more than others, and that just has to do with training and experience and who they're mostly working with, the size of the city they live in, who's specializing in what. But I would say the best case scenario is that your gynecologist runs these timed serum blood tests, right? FSH, estradiol, LH, prolactin, AMH. Those are kind of the 5 biggies blood work for fertility care. And those have to be run on certain days of your cycle. Those aren't helpful numbers if they're not run on cycle day 2, 3, or 4, meaning your period starts cycle day 1, cycle day 2, 3, or 4. And they also, if you've been trying for a year and you've never seen a positive pregnancy test, might order an imaging to see if your tubes are patent, to see if your fallopian tubes have any, if they're open. So that's called a hysterosalpingogram, or an HSG. They push dye through your fallopian tubes while they're x-raying it. So that's kind of the standard of care. And if you get those results back and they say, oh gosh, your fallopian tubes are open and gorgeous, and no sign of scarring or anything like that, and the blood tests are all where they should be, and I'm happy to go through those values if you want, but I think most gynecologists would say just keep trying. Or to the type A, the ones who've already planned this baby 6 years ago, those are the women I end up usually working with, they say, well, If you want results faster, let's refer you over to the fertility clinic. And the fertility clinic is going to run the same tests and maybe do a little bit more digging, but oftentimes they say, well, we think you'd be a good candidate for IVF and let's get started. And it really happens that quickly.
That quickly. I
Yeah.
have just as we're going through this, and I will keep going, but is it standard of care to also test the male partner?
Yes, it is standard of care, but that doesn't mean it's done. And I think there's so much room for men to get on board. And I speak a lot about working with women and talking to women because I'm marketing to women. I've never once in my years of doing this had a male come to me and say, my wife and I are trying to get pregnant and we'd like to get tested. I'm always first interfacing with the female, and almost always the partners are on board to have a semen analysis or some blood work done. Not always, but they usually are. And but they're not spoken to very often, and they're often neglected in the conversation, which is
Yeah.
outrageous because the research says that 40% of couples who are having trouble getting pregnant or staying pregnant, it's male factor infertility is involved, whether it's entirely male factor or partially male factor.
And I know
40%.
what it
I
like
think that's a
take
low estimate. I
yeah.
mean, I think it must be 50.
I
How could
gotta
it not
think.
be?
I mean, and the thing is like so my side less about fertility, but I spend a lot of time researching nutrition and researching how our farming industry has changed and
Yeah.
how the way that we have sprayed glyphosate, which is Roundup, on everything, and like the mass amounts of studies that show 40, 50, 70, 80% testosterone and sperm count decline over the last 50 years in men. And like, I mean, it's all over on the chemical
Oh
side
yeah.
of our health decline that we've had. And we know fertility rates have been dropping massively over the last 50 years as chronic disease rates have been increasing massively. And I love that where we started this conversation was epigenetics, because it's like, you know, all medicine in the roots of medicine was, first do no harm, then treat the disease cause that's in front of you, and ultimately prevent illness, right? Like have the practices in place for prevention. Well, epigenetics, we're getting deep into prevention here,
Right.
multiple generational factors. And so it just is like crazy to me that it's not just a standard, no matter what, the two of you want to come together and have a family. The two of you are in this conversation. The two of you are both going to be equally investigated in this process in order to support health and healing. And when I was taught from Dr. Tom, who's been on the show, big mentor of mine from Portland area, he's now in Scottsdale, and he would talk about natural fertility and naturopathic fertility, and it was always both male and female work on the fundamentals of health in their diets, in their detoxification pathways, in supporting their bodies all the way through, even if it's not quote unquote mechanically, specifically physiologically, you're still increasing the epigenetic health of that offspring by working with both partners,
Yes, and
wherever the source
you're
is.
crazy if you think that if you have enough sperm that your job is done.
Right. It's not
And
just the count
there's such a
too, right? Yeah.
disengagement there. And you're right about the glyphosate. I mean, there was a study done. It was kind of old now. It was in the 90s, and it looked at men who ate mostly organic and men who ate none organic. And the men who ate mostly organic had 100% more, meaning twice as much sperm as the men who ate conventionally. I mean, if we had an analog to the semen analysis in women, my job would be a lot easier and there'd be more research on female fertility, right?
Yeah.
It's so easy to like take the snapshot of men's fertility along the way to see what interventions are helping or hurting.
Yeah. Yeah. Great. Okay, good. So back to where we were. So there's like, that's the pretty fast jump, is like, you go to your gynecologist and then you go to the reproductive endocrinologist and they're like, you're a good candidate. Let's just go for it. You can make this whole thing happen faster.
Yeah.
So then we have us, you in particular,
That's usually
naturopaths.
when people start doing their Google search
Yeah.
for natural fertility support. And
And what
they
do
call
you
me
then
and
get to, yeah.
they say I'll do IVF if I have to. I hear that all. I'll do IVF if I have to. But I don't think I do. Like they have an intuitive sense of if I could just figure out why we need it. And they say they don't say we, unfortunately. If we could just figure out why I need it, like maybe we could just fix that and I could get pregnant naturally. So that's the starting off point is can we get you diagnosed? Can we explain unexplained infertility, which is more or less my clinical promise. Once in a while I don't meet that promise, but that is the goal with everyone I take on, is that we're going to explain why. And whether
Right.
that leads us to natural treatment or conventional treatment or some
Yeah.
interface, we're going to at least give you the reason.
So then looking from there, what are some of the most common things, if you kind of, it doesn't have to be your exact precise analysis, but like what as you work down the list, like I run into this
Mhm.
with 50% of my population, 40%
Sure.
dealing with this, like give us some of those top line.
I think hidden autoimmunity, specifically Hashimoto's, is a huge one. Just women didn't know that we're walking around with this high antibody load that's affecting the quality of the follicles. Environmental exposure, it's hard to deny that one anymore. The research is coming in, and we see its effects, at least on male fertility, that the phthalates and the BPAs are worsening the quality of our reproductive cells. Stress and sleep is one that just doesn't get looked at all in conventional medicine. And I can't tell you how many cases where that was the linchpin, the cornerstone of the case was dealing with the stress. Um, and ovulatory cycles. I think most women assume that if they're cycling, if they're having a period, that they're ovulating, and that's clinically, that's not what I've seen.
Clear. Totally clear. So I want to go back to the environmental factors a bit. Like, um, on one hand, there's a lot of information out here on this, but let's just kind of run through for people what some of the biggest sources are that they have control over. Because one of the tricky things with environmental toxicity is it's a very easy place to feel helpless fast
Yeah,
because there's so much exposure that happens to us that is very difficult to control or limit without feeling a bit like a crazy person and living as a family in a bubble and like
right.
all that. So
Yeah.
what would you counsel people to start to reduce their exposure and then also potentially increase their body's capacity to detoxify?
The lowest hanging fruit is the Teflon pans, like the traditional nonstick pans. And you hear it and you're like, surely that's not true. Like,
Yay,
surely
forever
where
chemicals.
I cook
Yeah.
my egg, yeah, doesn't actually make a difference. It does. Like
And if
that's
people want to really dive into that, there's an amazing movie documentary that came out called Dark Waters that gets way into where forever chemicals came from and the problems and basically the way the law got written that said, and I'm paraphrasing here, so this might not be exactly a little emphasis from the drama, but basically said, we know we can't do anything about removing these, so we're not going to track how much exposure is out there. And they just
like, why
said
bother?
that was it. We can't fix
Wow.
the problem, so we're not gonna track the problem. And
We're
so
not even
exposure
gonna
rate
continue to
was like,
look.
and then the research just disappeared conveniently.
Yikes. Well,
So Teflon pans, top of
so
the list.
forever chemicals.
Yeah.
All right. Anything that has a really loud smell, right?
Mm,
Or anything that's job is to smell is really what are going to hold the most phthalates. And I think that's having the biggest impact. Huberman did a really interesting interview of Dr. Swan last year. I think it was last November. And it was all about this. So it's a good resource, especially for the dudes. They tend to like listen to Huberman Labs more.
yeah.
But the high fragrance things, so whether it's like the Axe body spray or the air fresheners that you're using in your car or your home, or really any detergent, like they've done plenty of studies in marketing to show that like people, what they want out of their laundry is for it to smell good when it comes out, and that's problematic. We don't want it to smell good. We want it to smell like nothing, right? That clean nothingness. um any scent we're adding to our clothes or our bodies is going to contain chemicals that worsen our fertility. And I think it's it takes a minute to disengage from those products, but you know, do it
Yeah.
slowly. As the bottle runs out, don't replace that. Like find something different. And the scents that you can use are essential oils. But if anything, any product you're using regularly, and this isn't like, like the twice a year date night, you do a little perfume, fine. Um,
Right.
but if a product you use most days has the word fragrance as an ingredient, the only way that fragrance can get in there is carried by phthalates. So that product is not phthalate free if it says the word fragrance on it. So that's something that you can just search for in your cabinets
Okay, great.
and get rid of.
Yep.
Honestly, those two things, the
The
Teflon
Teflon
pans
pans and
and the
fragrance.
high fragrance items,
Yep. And,
that would have big
especially because
impact.
I'm going to make a little bit of an assumption, us being Utah, Colorado girls, the outdoor industry has had an interesting run with the issue of forever chemicals being like Gore-Tex. That's how
Oh,
Gore-Tex is
yes.
Gore-Tex, right?
Mm-hmm.
And things that are 100% waterproof and like,
Or our
you know,
leggings. I mean, like I'm a
leggings. Yeah.
millennial and we wear leggings every day. Like
Right.
sports
And
leggings is our
those were
uniform.
places that I was like, "You're kidding me."
Mm-hmm. Yes. And I
And,
have
I
less.
go back and forth about like, "But how much am I really absorbing and how does that actually work?" But still, it's just
Well, if they're shutting down research in that area, I guess we'll never know.
yeah. And it's like, I do take things on step by step, by step, by step, by step, right? And
Right.
I will admit, I've been interested in this process since I was younger than this even, but really started naturopathic school at 25 years old. So I got 20 years of continuing to dissect my environment and be like,
Hmm.
why do I have this in my life? Okay, that's
Yeah.
getting replaced. And I just
Hmm.
keep, the plastic products and moving to
Methodical.
glass and changing my cookware. And but what's
Oh,
interesting,
cookware. Yes.
yeah,
Can I
the
add
whole, yeah,
one? Can I add one to my list
yes,
of of Teflon pans and high fragrance items? It would be heating in plastic Tupperware.
yeah, yeah,
If we can just stop putting hot food into soft Tupperware,
yeah,
that would be the third. Those
yeah.
three things.
Definitely. So glass, I got, the Pyrex sets and the mason jars and all of the things in order to,
Yeah.
store my food in and yeah, I mean I remember in naturopathic school it was kind of the joke was at some point this didn't to be honest this didn't last long for me, but I had this moment being a Portlander that I was going to ride my bike to school and this was still the time where not everything was digitized, so I had a fair amount of books, physical weight of
Hmm.
paper type things I
Yeah.
needed to drag around with me, and my laptop, which was not lightweight. And then I had my glass Grolschreiner water
Got to.
bottle that I would
Yep.
reuse, and then I had my mason jar of lunch, and, like, literally, it was, like, 50 pounds with
Heaven
all the
forbid your
glass
bike
containers and
tip
everything, and
over.
I'm like, yeah, that didn't last. I went back to driving to school on the regular, and I would have, like, this whole world, but it made sense, and it's nice to not have to drag all that stuff around with me anymore. Yeah. So that's, okay, so we've got environmental exposure as a place people can leg up, getting proper lab testing around thyroid function. And that's one that
Mm.
just in my practice as a whole, we run into is many people say, oh, yeah, I mean, my doctor tests my TSH, my thyroid stimulating hormone every single year, and it's normal. And I'm like, you can have completely normal TSH levels and your antibodies can be climbing and climbing and climbing long before you ever get to that point. And so I routinely, and I don't do a lot of screening tests, like, I am not heavy handed with lab tests, but every single client I have, no matter what their age or gender, I test everybody for a full thyroid panel with antibodies at least once to at least just
Absolutely.
get in that world.
Absolutely. And I track the free T3, free T4, and TSH pretty regularly as I work with someone because um, those hormones are getting well. T2 is the hormone. T3 turns into T2. We can't test for T2. That one is the one that gets into the follicle and affects the growth of the egg. But the antibodies have to be tested at least once. I see it most in secondary infertility. So this is the patient that comes to me and they say, I have a 4-year-old, I have a 5-year-old, 6, 7-year-old, and we just haven't been able to get pregnant again.
Yep.
Typically, Hashimoto's rages after pregnancy, or I'll see
Yeah.
this sometimes if somebody had a loss, a miscarriage, and then they just couldn't get pregnant again after that. Hashimoto's is often triggered, or that those antibody production is triggered by a hormonal event, right? Puberty or menopause or
Yeah.
a birth. Um, so that's certainly one of the, I would say 30% of my practice is autoimmune.
Yeah. Yeah, definitely. So then, I mean, I want you to answer from your perspective. I have my thoughts on this, but like, say they're not necessarily struggling to get pregnant, but they're really interested in, we just want to be as healthy as possible. Like, what
Hmm.
would be some of your recommendations for people to take on, and how long before they're starting to try would you say that they should be at work on this?
Oh, great question. The it's just such a like it might be a disappointing answer to your listeners. It because it's the basics. It's, are you exercising? Not too much, not too little, but like, are you lifting weights? Are you getting your 10,000 steps in every week? I working with people in the mountains of Colorado. I live in Steamboat Springs. We have more Olympians per capita than any other town in the United States. I work with I in local practice worked with really high level athletes. And for me, the conversation usually is like, let's bring down the
Overtraining.
exercise. Let's
Yeah.
exactly,
Yeah.
let's get you out of these hour and a half manic, um,
5 days, 6 day a week,
exactly,
always. Yeah.
which is awesome and totally. I mean, I don't know if someone can say totally fine, but like maybe better for someone who has decided that their family is complete or is not actively trying to have babies. But for trying to make the reproductive system feel safe and secure, running and running and running, your body eventually figures that you're running from something, and it is a stressful thing.
We don't
Even
know
if it
why
makes
you're
you
running
feel
at,
good.
40 miles a week. There must be a problem here.
Well, just this weekend in
Yeah.
Steamboat, it was the Run Rabbit Run. It's a 100-mile race.
Yeah.
If you are running for hours, yeah, your body is going to put you in a stress response state, and
Yeah.
that's on purpose. So I think counseling patients, women and men, on what they're doing for exercise and making sure it's right, that Goldilocks, not too hot, not too cold. Is their diet high in protein, not too high, full of fruits and vegetables, seeds, beans, nuts, right? Like, it's basics. Are you
Yeah.
giving your body a rest from food for 12 hours? Um, how are you resting? How are you sleeping? Like, getting the foundations of health in place. And that's easy for me to say as a naturopath, because a lot of the, we assume this and acknowledge that everybody knows what these cornerstones of health are. But I
Yeah.
think we have to say it again and again, because not everybody does have this information. And if
100%.
if you're not doing some sort of mindfulness activity and putting your body in an easeful state, and if you're not getting the sleep you need, and there are fun ways to do this, right? There's gadgets to track, and there's apps to use. But I think the advice for someone who's planning needs to be, get your ducks in a row, the ones that you have control over. What are you
Yep.
eating? What are you doing for exercise? How are you resting?
Yep.
And you should be doing this 3 to 4 months before you plan to conceive. That's the window. For men, it takes about 90 days for a sperm to be created, right? They can just make those anytime. We're always making those. And for women, even though we're born with all of our eggs, they live in this really like dormant state. They're in the primordial kind of soup in your ovaries, and they're called to start development about 3 or 4 months before they are ovulated and released. So that's when we have the most impact on, can we get those antibodies down? Can we get the environmental exposures out? Can we get the stress piece out of the picture? Because all that has influence, especially as they are developing from, you know, oocyte to released egg.
Yep. Yeah. Well, I'll make yours sound even better, because Dr. Tom's stance was a year. He said, "Do
Oh,
not get pregnant for 12
I mean,
months. Give
that
it
would
a
be
full
great.
all 4 seasons.
Who's
Let
got
your
the
body go
time?
through all," and a lot of that is grounded in Chinese medicine as well, because it's
Yeah.
like we have our 24-hour clock that, each organ system has its peak time, when gallbladder time is, liver time, kidney time, but you have the same thing throughout the 12-month cycle of the year. So if you truly want to help reset at the deepest epigenetic level physiologically, you have to let your liver go through its whole cycle at its time of year, your gallbladder go through its cycle at its time of year, your reproductive, all the way, your cardiovascular system, circulation, all of the parts and pieces should have a full 12 months in order to create the best genetic epigenetic outcome. And then
That's beautiful.
when we get into the trauma conversation, which is
Mhm.
not necessarily the top of the forefront of what actually increases or decreases fertility, although that very much can be inside the stress conversation, right? Like some of the
Mhm.
sources of just the pressure we put on ourselves to get pregnant, to be able to have a family, what we make that mean about ourselves, inherited conversations around family from our families that we were born into, and, age and timing. Like there can be a lot of factors there. But, I again, going back to a lot of the nutrition studies, was like what they saw with I mean, this was a very old study in the 1930s or 40s, but it was recounted a lot as Pottinger's cats.
Yeah.
And Pottinger actually studied these feral cats that lived behind a restaurant, and they were eating cooked food all the time versus raw food. And he saw that in a certain number of generations, the cats were going completely sterile and they were unable to reproduce. And they were completely off their natural raw living food diet of mice and chipmunks and all of the things that a cat would normally eat as a carnivore, and was eating all these other foods cooked from behind this restaurant. And then started to do fertility studies in the cats to see how many generations did it take to actually bring that back online and have the cats have full fertility again. And it was 7 generations. So,
Yeah.
and we see this over and over again in different disease patterns, over and over and over again. And then there was another study that was done more recently around, and I again don't love the way that we torture animals in our biology studies, but they had taken rats and they had exposed the rats to a smell and then a painful stimulus. And this one generation of rats got exposed to the pain and the smell at the same time and got ingrained into it, so that then at some point you could just have the smell and their body would secrete stress hormones as if there was the pain inflicted on them. And then they took those rats and they had them reproduce. And in their offspring who had never been exposed to the pain stimulus, they would expose them to the smell and they would have the same stress response.
That's
And then
wild.
their offspring, and it took 6 generations of no exposure to this pain stimulus with the smell for the sixth generation to finally have no stress response to that smell.
It's amazing.
So, like, there's a world here. And so, while I'm very much a proponent of the nutritional and toxicity sides of things to be able to support, is I like to open up the conversation also of, and I have a girlfriend, she's actually been on the podcast, Kara Matsukane, that she does this work with couples around getting the relationships with their parents
Mhm.
complete,
Mhm.
healed to a level of calm and peace. It's not like, depending on how you are with your parents, you may not necessarily be like, "Oh, we're best friends now." But to actually do the work to heal the regrets, to heal the resentments, to get yourself, like, the more complete you are with your parents, the more free you're going to be a parent. And what
Mhm.
we end up bringing through our ancestral lines. And so then that's been kind of her epigenetic work, more on the
Yeah.
psychological and trauma side of things.
Well, I think that's very interesting, and I would make the argument that if in the real world and not in a study, that if somebody is being exposed to a stressor, that the body can often protect them from further stress of pregnancy and stop that from happening at all. And I think that's a lot of the work I'm doing or
Yep.
trying to do, um, is pointing out that the stress has an impact. And that was sort of a paradigm shift for my fertility work. I have 2 kids, and, um, personally, if you don't mind me telling a personal story,
Not at all. It would actually be helpful.
I this would have been 8 or 9 years ago. My husband and I decided, like, let's start having kids. And at the time, I was kind of new to the fertility field and very excited about it. And I did all the things. I did the detox and, full year on a perfect diet. And I was in Chinese medicine, uterus is translated to the baby palace. And I was preparing the baby palace. I was as ready as you could be. My numbers looked great. I felt great. No alcohol, no caffeine, like the whole thing. And we got pregnant on the first try, and it was great. It was easy, and I was like, "Look at this! Look what functional fertility medicine can do! Isn't this wonderful?" And I really, it bolstered my confidence clinically, but it put me a bit of a high horse for sure. So we had our first son, and he's fabulous. And a few years later, we decide, let's have another. So, okay, great. I do the detox, I make the diet perfect. It's a little harder with the little one in the house, but we do it. And at this point, I had learned more about fertility. I got my husband involved. Like, you need a semen analysis. Like, we need to learn more about your health. So we're both doing the work, and we're ready to go. On paper, I look great. We look great. And we don't get pregnant on the first try. We don't get pregnant on the second try or the third try or the fourth try. And I'm like starting to get a little, I think ashamed would be the word, because I'm a fertility practitioner and my friends all know this. And I live in a small town, and they're like, wait, are you trying? Like, are you pregnant yet? Are you pregnant yet? And, 6 months in, it's like, why haven't we gotten pregnant yet? This should have happened by now. And on paper, I'm perfect. Zooming out, I was going through at the time a really emotional, a family trauma, I guess, is the best way I can say it without going into details. It was the worst thing I've ever experienced in my life.
Yeah.
And it took a while to get it sort of not wrapped up by any means, but to pivot and move on from it. And that was during me trying to conceive my second son. And when we finally had a moment of more or less resolve and move on, it was about 3 or 4 months later that I conceived. So it was 9 or 10 months into our trying process, but it wasn't happening. And I think for me, that made me realize that like the stress is a much bigger piece than what we're talking about or what we're thinking about. It's not about how perfect your egg quality is or how robust your progesterone is 7 days after you ovulate, though those are important. If we're ignoring emotional trauma, drama, stress, we're not doing our job. And the body, I think, was protecting, right? Or it was protecting me. And I think there's an unmeasurable, even though my eggs looked great, there was this unmeasurable force on them that was keeping me from getting pregnant. And 3 to 4 months past the closure of the stressor, it came easily.
Yeah. Yeah, I think that's a really important factor. And I mean, we could hypothesize about all sorts of things of where that comes from and what that's about. And to also remember that the majority of the things that we measure all the time were all immeasurable 10 years ago, 20 years ago, 50 years ago, 70 years ago, right? And we think, oh, it's just preposterous. We obviously know everything that there can be measured now. And it's like, well, no,
Sure.
science has only taken us so far. Like we routinely focus on 30 to 40 hormones in the whole body. And the idea is that there's probably at least 120. So there's a whole bunch we haven't even figured out how to measure. Like you were
Right.
saying, we can't measure T2. We know it exists. We just can't measure it. So there's all sorts of factors there. But then also, I tend to lean a bit more this way of what are our sacred contracts and what's our spiritual relationship with this child that's coming into the world, and how something, like you said, this immeasurable force is coming in and just saying like, no, 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 this is
Not
not the
yet.
moment to add that on top of
Mm-hmm.
everything else. And I'll say it so you don't have to, but that's one of my beefs with IVF.
Yeah.
Is forcing a pregnancy when all signs in this person's body and life may be pointing to this is not the real time. And then dealing with the physical health, mental health consequences that can potentially come from that, which is a whole area that's very controversial to talk about. And, it's like we live in a space, and each person's their own journey. And I truly trust and believe that there is no inherent right or wrong about any of this. But it is very interesting how often, you know, when we do force those pregnancies, what then the next 20, 30, 40 years of that family's life ends up being, because there were things that were not taken into factor that could have been and could have been prevented in a way to provide as much
Right.
health as possible and just less stress. I mean, there's a lot of factors to why we've had the increased level of neurodivergence in the world in the last 40 years. And I've been one of the people that talks about, I don't necessarily think neurodivergence is a disease. I think that there's a lot of aspects of neurodivergence that's our evolution as being human beings and where we're going, and that it's not necessarily true that just because we're bad assembly line employees does not make
Sure.
us non-fully functional human beings. It's just our culture might need some updating. But there
Right.
also is you cannot argue with the fact that the level of neuroinflammatory illnesses and diseases autism rates, ADHD, attention focus challenges, sensory focus and, sensory overload issues has astronomically gone up in the last 50 years. And the massive stress impact that that can be. I mean, I just recently spent some time with a father of a child that deals with PANS and
Mm.
pandas, which is a psychological set of symptoms that we now have a deep understanding is massively tied to environmental toxins and like mold toxins and things like that and exposures. And you literally can have a child that was completely normal functioning, and 2 weeks later they flip a switch to extreme levels of OCD, paranoia, violent outbursts, harming themselves, harming others. It is really hard on families. And where I think that there's room for us to have bigger conversations is a role of what is our true do no harm
Hmm.
responsibility in the way that we approach fertility.
Sure. And getting someone pregnant at any cost or is not is isn't is not the outcome we want,
Yeah.
right? IVF is incredible medicine, but it's jumping over. It's jumping over a few steps for sure. And I think my ultimately my concern is that it's it's not the safety net that everyone thinks it is, right? Like they come in being like, well, I guess I could always do IVF. It's like, well, if you're over 40, the odds of IVF, one round of IVF resulting in a full-term pregnancy, it's like 10-15%.
Mm.
It's not like, oh, this great big safety net that will guarantee me this baby over 40. The outcomes aren't like great either. So I don't know. Yeah, I mostly work with women who are coming in trying to avoid it. So it's a fun challenge, and it's a really rewarding one.
Yeah. And I realize this is, going to be straight up your clinical experience, but I would imagine the work that you do also supports people that if they do end up taking that route, you have increased success rates because their body is in a better position to accept that IVF. Have you seen that?
Absolutely. Because because we've done the work, and
Yeah.
they wanted that baby, 3 years ago. So as they said when they met me, I'll do it if I have to. And sometimes they have to. If they want to carry their own genetic baby, like that, IVF is required. And they're in such a better condition after working with a functional fertility doctor because we've lessened that stress load. We've unburdened. We've got them resting and moving and eating well, and their egg quality is high, and their uterus is in better shape, and their inflammation is lower, and there are no more hidden infections, right? Like we've taken them through the paces of naturopathic medicine, which is beautiful, and they're much better for it. I
Yeah.
have patients often 4 or 5 months into working with me saying, and I expect the email of like, why aren't I pregnant yet? And instead I get the email of, even if I don't get pregnant, I feel so much better.
Yeah.
And I mean, I can't guarantee natural pregnancy at the end of working with me, but I feel pretty confident that I can guarantee that I can improve your fertility. And in
Yeah.
improving your fertility, I, we've improved everything about your health, right? It's transformational.
And that's kind of like the ultimate, and you're the expert in this area, but I think about it as naturopathic medicine as a whole is, I mean, I say the same thing about disease reversal because I mostly work in pretty intense chronic disease scenarios, and I'm usually not the first doctor they've gone to. So they've already tried three, four other
Hmm.
people before they get to me. And it's like, I may not be able to guarantee the alleviation of this symptom or making this thing completely go away, but I literally can promise you the best side effects of my medicine is improved sleep, better libido, less
Yeah.
digestive problems, less pain, feeling more like yourself. Like there's all of these other components that start to come together. But like when you think about pregnancy and procreation and literally the creation of life, our bodies need to be in a safe,
Yeah.
well nourished, supported, like ultimately the best possible baby palace ever. And that's not just the womb, that's like our whole world, our
Yeah.
whole life wrapped around us. And, the pandemic was an interesting time for fertility and for babies because the world stopped and we actually had the ability to sit still in a way that we hadn't. And, a lot of people decided to drink more at home, which isn't the best way to go about that. But also there was this interesting, and again, this is anecdotal, but I remember somebody talking to me about how they were seeing the strength in newborn babies at 3, 4, and 5 days old that moms had been pregnant through that first year of 2020 was like the same that they would see the strength of babies at 6 and 7 weeks before. Like they're picking their heads up, they're rolling around in a different way, the
Mm.
strength of their neck. Like they were physiologically stronger because their mamas mostly had to sit still way more than they would have during the shutdowns.
Sure, they were cooking more, they were making sourdough, they were putting their feet up, they were
Yeah.
enjoying paid time off, right? Like they were getting the rest that our culture does not provide.
Yeah.
It is uh yeah, it's an error of our culture that
Yeah.
we don't know how to slow down. As I say, I mostly work with type A, and these women, they kind of love their stress.
Yeah.
It it fuels them. It without it, they wouldn't be able to be the superhuman that they are, of like doing it all. But it's, we can make the argument that maybe it's not serving their fertility, and we have to shift the mindset.
Yeah.
How often are you at ease? How often can you relax?
Actually tracking that and noticing throughout the day.
Mhm.
And, it's somewhat, I don't know, it can be back and forth whether it's annoying or a stress relief, but just a 3-minute pause multiple
Yes.
times throughout your day of just looking out the window, staring at something green, better yet, being outside and actually with that green thing. But your parasympathetic nervous system will reset in those 3 minutes. And actually,
Yeah.
then you get this longevity benefit from it over a period of time. And, splashing cold
Touching
water on your
the
face.
present moment.
Yeah.
Yes.
Yeah.
Mhm.
Having a pet, petting your pet, like there's all of these places where we can actually bring our nervous systems back down into that regulation space in these little moments throughout the day. And smiling, laughing, a hug, the touch of a loved one, gargling, humming, singing. My favorite is orgasms increase our resilience for stress for 72 hours after having them. So this is like
Yes.
all the wonderful things about trying to get pregnant are benefiting our overall, well-being in so many different ways.
Yes, and so much less intimidating to say, like, have an orgasm or touch a pet or, take a deep breath and look outside than 20 minutes of mindfulness meditation a day, which I would love to get everyone to, because it's transformative. But
Yeah.
people are, that seems to be like too big a hurdle to get at. And if we can bring people into present in little points throughout the day, that's going to be just as beneficial.
Yeah. I'm going to put a plug in here, and I have no tie to this company, but there's an app called the Triple Flame app. And what I
Hmm.
love about it is it's actually tied to a system of kind of like self-reflective, either gene keys. Gene keys is the system it's tied to, which is in human design. If people have ever heard of the human design work, is sort of astrology mixed with a couple other things. But the Triple Flame app, what I love about it is it's a mindful app, but all it does is just suggest that you pause. It's not
Right.
even about a breathing exercise or meditation. It's just literally pause. And then it has notifications throughout the day where you can set what frequency or what times you want it to be at. That'll just give you a little notification. And then you just click the notification, it opens the app, and it just says 3-minute pause, 5-minute pause, 10-minute pause, with music, without music. You can set whatever your favorite defaults are.
I love it.
And like that alone it's remarkably impactful. And especially my clients who are already dealing with anxiety, dealing with high stress states, they know that part of what their symptoms are is in that realm: insomnia, difficulty slowing down at the end of the night. They are exhausted at 6:30 and then they get a second wind and then they're awake until midnight. Those patternings, just that momentary incremental 3-minute pause. And as much as we are busy and we're high performing, really, you can't give 3 minutes,
Right. Right.
just 3 minutes. Yeah.
Well, and I think my patients are certainly skeptical that something seemingly so small would have any impact at all.
Yeah.
And I wonder if you come across that too with your patients who have seen many, many doctors, and they finally land on you and they're like, wait a minute, I've given you the big bucks and you're telling me to pause for 3 minutes, right? Like
Pause,
what,
drink water, and eat broccoli. And they're like,
right?
really?
You're
Really?
like this.
I
But we
mean,
take for granted that people have already tried it, or
yeah.
I think people assume that it can't have big impact because somehow that's been the story they've heard about medicine, is like only medicine treats disease,
Yeah.
and these other things aren't contained in that group. But yeah, they just kind of skip over it. Like, oh, maybe that'd work, but there's got to be something more impactful.
No,
And
I
no, back
absolutely
to basics,
find
baby.
that I mean, that is the fundamental of my
Hmm.
practice. Like there is no single person, and I'm a huge fan of homeopathy and herbal remedies, and I use a lot of supplements for sure to help adjust biochemistry in the body. I usually don't start any of my new clients on that till 3-4 months down the road. We're
Nice.
doing all lifestyle building because I want to have them have the direct experience of no, actually being fully hydrated for multiple weeks in a row will make a difference. You will
Makes
feel
you feel
your
better.
energy
Yes,
better.
you'll notice.
You're
You'll
not as groggy
notice.
in the morning. You
Hmm.
sleep better if you
Yeah.
have that, like it's remarkable to me how many people, will come in with pretty significant GI issues and literally water in the correct amount day after day for multiple days in a row, like more than
Lo
5.
and behold, they're having
And
bowel movements
and
every
it's
day.
amazing how much of a difference that makes. And
Yep.
so yeah, I think that actually we're so programmed to the most complex solution must be the best solution and the most expensive solution must be the most important solution.
Yeah.
And yeah, I'm a huge beating the drum of the basics over and over and over again. And also part of that is like, let's use your economic resources to what really, really matters. If I can get 50% of your symptoms alleviated through stuff you already have in your house,
Right.
then we can decide to target with, I mean, the correct fish oil and turmeric is not cheap. So,
No,
like, when
no.
we start to get into some of those anti-inflammatory interventions, we want to be able to use the minimum dose to maximal economic investment. I don't want to just throw an $800 supplements,
Hmm.
recipe at you and be like, good luck with that. I think it's
Right.
not,
Continue this on for the rest of your life.
yeah, exactly. Exactly. Ah, Dr. Grace Charles, this is amazing. It has been absolute pleasure. I'm, as always, clear that we could keep going and going and going. And it just, the place that you stand and the way that you take care of people and the conversations you're interrupting to help them really reconnect to themselves in this process. I mean, it's like, all those questions of why do you want kids anyways? What is this really about? What is the experience of life that you want to be having?
Hmm.
And all those parts and pieces that, just getting people to pay attention, to wake up, to notice some things and to tune into their bodies. It's awesome.
Thank you. This is so fun to talk about.
Yes. Until we get to do it again.
Yeah, of course. I mean, anytime, but thank you for having me. This has been a
Yeah.
really exciting conversation.
Great. Good. Thanks again, and thank you guys for being here.
Bye.
Thank you for being here. This conversation is your invitation to remember that healing can be messy, hard work, and also beautiful. Stay connected. Join my newsletter at sarahmarshallnd.com or through the link in the show notes. Until next time, keep asking the questions that matter, and you will find your own path to healing. And of course, a special thanks to my extraordinary and generous guests, my producer, Joshua Watherston, video editing by Nellie Dawson, artistic graphical design by Amy Pruitt, and music by Roddy Nickpour. And as always, thank you for being here.